This presentation is going to be on population-focused practice. As with most of nursing, we see cyclical changes in the profession. Although in the past few decades, public health has taken a backseat to new technologies. New concerns have led to a renewed interest in public health and public and community health nursing. This is due to reduced access to health care related to provider mergers and other private market forces, a reduction in the number of Americans able to maintain affordable insurance coverage, the relationship between quality of service and increased costs, very real threats of bioterrorism and concerns about global health threats such as SARS, West Nile virus, and similar illnesses, contamination of our food supply as experienced recently with mad cow, strawberries, spinach, meat, and the tomatoes and peppers, and most recently cantaloupe contamination instances. Although population-focused public health functions account for only 5% of the nation's health expenditures, it is these functions that are credited with an increased life expectancy from 50 years in the 1900 to 77.6 years in 2005. And I know those numbers have increased in the last 8 years as well, although just recently I believe there might have been a slight decline. A 50% decline in stroke and coronary heart disease deaths and overall decline in death rates for children by 50% has also occurred. It is believed that medical treatment can only prevent 10% of early deaths, whereas population-focused interventions can prevent approximately 70% of the deaths. Some approaches to look at are behavioral approaches, and these would be changing contributing behaviors such as tobacco use, diet, and sedentary lifestyle, for instance. Environmental factors include social and working conditions, education, culture, economics, and housing. In 1988, the Institute of Medicine defined public health as what we do as a society collectively to assure the conditions in which people can be healthy. Essential services by core functions are assessment, policy development, and assurance, and are specified on the next slide. The IOM's 1997 monograph was put out to help practitioners be more successful in the implementation of these core functions, improving health in the community, role for performance monitoring. These core functions are the key role of public health practices. They include assessment. Assessment is the systematic data collection on the population, monitoring of population's health status, making information available on health of the community. Policy development includes the need to provide leadership in developing policies that support the health of the population, including using scientific knowledge in making decisions about policy. Assurance is the role of the public health nurse in making sure that essential community-oriented health services are available, which may include providing essential health services for those who would otherwise not receive them. This also ensures a competent public health and personal health care workforce is available. Within the 3 core functions that you previously saw, you will find 10 essential public health services. View the list on this slide. Assessment. So what is included under assessment? Well, you guys are all nurses, so you know that we monitor the health as public health nurses. We diagnose and also investigate. So what are we going to do to monitor health status? We're going to identify and solve community health problems, such as profile the community health, use vital statistics, and also use the health status. We're going to diagnose and investigate health problems and health hazards in the community, such as using epidemiologic surveillance systems and laboratory support. In policy development, you will notice that the nurse will inform, educate, and empower people about health issues, such as health promotion and social marketing. Mobilizing community partnerships in action to identify and solve health problems, convening and facilitating community groups to promote health. They also will develop policies and plans that support individual and community health efforts, such as leadership development and health system planning. In assurance, You will see this includes enforcing laws and regulations that protect health and ensure safety, such as enforcement of sanitary codes to ensure safety environment, linking people to needed personal health services and ensure the provision of health care when otherwise unavailable, such as services that increase access to health care, assure competent public and personal health care workforce by using education and training for all public health care providers, evaluating effectiveness, accessibility, and quality of personnel in population-based health services by using continuing evaluation of public health programs. And in this section of assurance, you'll also see that the need is for research for new insights and innovative solutions to health problems, such as links with academic institutions and capacity for epidemiologic and economic analysis. Community health assessments help measure how well a public health system is fulfilling its assurance function. So, to be effective as a public health nurse requires a special knowledge base. Its focus is on populations that in general are not institutionalized. They focus on health promotion, health maintenance, and disease prevention. It is community-oriented, meaning that public health nurses look to the connection between the health status of the community and the environment in which they live. Interventions are made at the community or population level. Policy is often used when developing interventions. All members of the community or population are important, especially the vulnerable. When you look at this stream, what do you think about? When I look at it, I see an uphill battle. Imagine this stream or river is an illness. We are often so busy rescuing victims from the river, we fail to look upstream to see what is pushing them in. Upstream actions focus on modifying economic, political, and environmental factors that are precursors to poor health. The aim of community health nursing is to prevent people from falling into the river in the first place, so people in the community are able to recognize their health needs and help develop strategies to improve their own health care. So let's now really talk about population-focused practice versus practice focused on individuals. Let's first talk about population or aggregate. What is the definition? This is a collection of individuals who have one or more personal or environmental characteristics in common. Now, I'm sure you have heard about this or read about it in the book. Often large populations can be divided into subpopulations, which more specifically define a smaller group within the population. For example, population, infants under the age of 1. Subpopulations within that group is high-risk infants under the age of 1. The 8 principles of the public health nursing, as you can see, the focus is on the group for the unit of care. The greatest good for the greatest number is what is important. The clients are equal partners or stakeholders in the health of the community. Decisions that impact the environment should allow populations to thrive, optimizing resources. Population level decision-making is different. The focus here is on the group for the unit of care. The greatest good for the greatest number for what is important. The clients are equal partners, stakeholders in the health of the community. Decisions that impact the environment should allow populations to thrive, optimizing resources. As you can see from this diagram, on an individual basis, you already take care of members of all of these populations, but your focus is on the individual. At the community level, we encompass all the members shown. On a population level, you may only be looking at women aged 15 to 24 to see if they've had their Gardasil injections, or you may be interested in men 65 or older to see if they've had a PSA drawn or had prostate exams. Or if you're looking at infants, you may be concerned with the percentage that were fed a particular formula, which had been found to be contaminated. So let's break up some of the types of nursing that you're going to see with public health nursing and community health nursing versus community-based nursing. Public health nursing as a field of practice. Public health nursing section of the American Public Health Association. They are also go by the American Nurses Association scope and standards. The educational preparation is at the baccalaureate, and they are beginning staff public health nurses. At the master's level, they develop specialty in public health nursing. So public health nurses are community-oriented. Their focus is on population, and they develop strategies for this population. Community-based nurses have a combination of population focus and community-oriented strategies in direct care with clinical strategies. Community health nurses apply to all nurses practicing in the community but not in an institutional setting, whereas community-based nursing is either acute or chronic care, generally illness-oriented. They provide care to individuals and their families. This care is provided where they work, where they live, and where they attend school, generally in the home or community settings. The philosophy of practice is comprehensive, coordinated, and continued care. Community-oriented nurses include public health nursing that focus on healthcare of the community, and it includes community health nursing, primarily focused on individuals, family, and groups in the community, and community-oriented nursing in a nursing specialty. On this slide, you will see a depiction of community health nursing. This indicates the three role functions suggested for nursing care. Public health nursing and community health nursing, which together make up community-oriented nursing, and then community-based nursing, included in boxes A, B, C, and D, and provide comprehensive, coordinated, and continual services. Roles in public health nursing include public health nursing administrators, the staff nurses. These roles also include planning curriculum to prepare staff nurses or generalists and identification of skills and necessary knowledge. Some of the challenges to specialization in public health nursing include barriers. The only role is direct care. There are structures in role socialization and few nurses with graduate level preparation. Organizational changes occurring in the delivery system. Baccalaureate education is becoming a minimum expectation. Specialization in public health nursing and nursing administration require advanced nursing education. Access to basic primary care will get worse, and nursing leaders must be forward thinkers and be a part of the changing healthcare arena.